Hello everyone. Hope all are happy, healthy, and fit. IBD refers to chronic inflammatory bowel disease with remitting and relapsing course. There are two main diseases which comes under this: Crohn's and ulcerative colitis. But 10 to 15% of patients cannot be classified into either type. So, what are the differentiating features of these two? Crohn's disease has transmural inflammation that is involving all intestinal layers and skip lesions that is patchy distribution and mainly involves the small intestine, whereas the opposite holds true for ulcerative colitis. Perianal involvement is more common in Crohn's disease. Grossly bloody stools are typical of ulcerative colitis. String sign is usually found on barium studies in Crohn's disease. Smoking has a negative effect on ulcerative colitis, whereas it is protective for Crohn's disease. The exact cause of IBD is not known, but genetic, environmental, infectious, immune factors seem to play a role. Still, 85% of patients don't have positive family history. Clinical features include diarrhea that lasts longer than 4 weeks, tummy pain, blood or clear slime in stool, feeling tired all the time, weight loss without trying. There may be extra-intestinal symptoms in 10 to 20% of the patients, like arthritis, uveitis, or liver disease. Fistulas, abscesses, strictures, and toxic megacolon may result as complications. Diagnosis may involve biomarkers like ESCA, ENCA, inflammatory markers in blood like ESR, CRP, inflammatory markers in stool like fecal calprotectin, barium studies, CT, MRI, colonoscopy with biopsy remains the gold standard in diagnosing it. Treatment depends on the severity of symptoms. For mild diseases, a step up approach is usually carried out. Aminosalicylates, it's at step number 1. If that fails, then steroids are prescribed. If that doesn't work, immunomodulators and biologics are considered. Clinical trial agents are used as the last resort. The role of biologics and immunomodulators is much more important in moderate to severe diseases. About 70% of people with Crohn's disease and 25% of people with ulcerative colitis will need surgery in their lifetime. The risk of colonic cancer is 4 times increased with IBD and is associated with chronicity of the disorder. Stay tuned for some more on Medicine Today soon.